Australians are being encouraged to embrace technology to combat loneliness this festive season. Health experts are concerned lockdowns, border closures and coronavirus restrictions will compound the issue after a difficult year. Well, joining me live now is Dr Michelle Blanchard, Acting CEO of SANE Australia. Merry Christmas to you, Dr Blanchard. Thank you very much for your company today. The festive season, it does bring with it so many expectations of being happy and joyful. How challenging is this Christmas period for people with mental health issues?
Yeah, thanks so much for having me, and Merry Christmas to you as well. I think while lots of people do look forward to this Christmas period, we can put so many expectations on exactly how the day is going to look, who we're going to spend it with, and what we're going to be doing. Often for people, when those expectations aren't met, that can really contribute to additional stress and anxiety. I think also for people who might be isolated, might be lonely, this period and the focus that we tend to place on spending time with friends and family can also really exacerbate that sense of feeling alone. So focusing on how we can support and make time for our mental health over this period becomes really, really important.
Now, obviously, there's Christmas to begin with, but we've then also had the pandemic, and some people, might be in hotel quarantine. This could be the first time they've been alone. What is your advice for getting through the holiday season?
Yeah, it absolutely is true that this year Christmas will look very different for so many people, and particularly those who've been directly affected by COVID-19 and the restrictions that might be in place. I think there's a couple of really practical things that people can do to really look after their mental health during this time. One of the really important things is to try and still maintain a sense of routine. So whether that's just getting up, having breakfast, trying to do some things throughout the day that you would have done anyway, whether that's around eating meals or talking to people on the phone, those types of routine aspects can be incredibly important. I think the other thing is really, if you can, reach out to someone whether it's via telephone, via Zoom, and just try and connect with people. Even if you can't spend that time physically together this year, just having that opportunity to check in and say hello, I think can be incredibly important. One of the other things that people might want to think about is limiting their use of social media over this time. And I know that sounds a little bit counterproductive, given that I've just talked about people connecting with each other, but sometimes people can find that as they're scrolling through and seeing friends or family, they might feel a bit left out, or it might exacerbate that feeling of loneliness. So tuning into that media that makes you feel good, that makes you feel connected, and perhaps tuning out from that media that isn't making you feel so great or isn't making you feel so connected can be really useful as well.
Now, the latest report out from the Australian Institute of Health and Welfare shows calls to services like yours and Beyond Blue and Lifeline A in September went up by 20%. Obviously, we've seen a lot occur since the month of September. Do you believe that this rise is reflective of the rise in mental health issues, or could it go much deeper?
So I think a lot of people have reached out for help and support over the last couple of months. I know for us, use of SANE's Help Centre and our forum service has gone up more than 50% since the beginning of the year, which I think is a positive sign in that people are reaching out and connecting. But it does also reflect that for many people, the events of this year have exacerbated pre-existing complex mental health issues that they may have had, or for others, perhaps this year's been the first time that they may have experienced anxiety or depression, or perhaps another form of mental health difficulty. It's probably too early to know whether or not rates are rising necessarily, but what we do know is that people are looking for that sense of connection and that sense of support to get through what for so many of us has been a really difficult year.
And how do you think COVID has changed the way we view mental health? Has it helped to take a bit of the stigma away, given that by the nature of what we've all experienced, what some people have referred to as collective trauma, it's helped people to sort of break down those walls a bit?
I think it does. You know, at SANE Australia, we work with people affected by complex mental health issues. And so many of the people we support have lived with mental health issues like schizophrenia or bipolar disorder for a really long time. And one of the things that a number of people have shared with us is that this has actually been a period where they've felt that the rest of the community understands their experiences a little bit more. So these are individuals who previously felt a little bit isolated, perhaps found it difficult to access care and support, perhaps had limitations put on their income. And so many of us around the country have experienced those same things over the last 9 months. So in many ways that has helped just to create a sense of empathy for what other people might be going through. I think also the increased public conversation about the need for each of us to make time for our mental health and wellbeing has definitely helped in terms of having just a sense that this is something that we all need to be focused on, and making sure that we're doing the things that help us stay healthy and well.
Dr. Michelle Blanchard, thank you very much for your time today, and Merry Christmas.
No problem. Merry Christmas.